Today, on the Optimal Anesthesia channel, we're shedding light on a crucial yet often overlooked aspect of anesthesia: humidity. Normally, our airways warm and humidify the air we breathe, keeping our lungs healthy. But in surgery, anesthesia disrupts this process, which can impact patients' safety and comfort. So, how does humidity, or lack of it, play into our anesthetic care? Our respiratory system naturally humidifies the air we breathe, warming it to body temperature and saturating it with moisture by the time it reaches the lungs. This humidity, about 44 milligrams of water per liter, is crucial for protecting the airway lining, aiding gas exchange, and keeping cilia active to clear mucus. However, during anesthesia, dry air disrupts this process, increasing respiratory risks. Research from Sahan, Riedel, and Gebhardt in Anesthesiology Journal highlights how essential humidity is for respiratory health under anesthesia. Let's explore the three big challenges we face in maintaining adequate humidity for our patients in the OR. Challenge 1: bypassing the upper airways. In normal breathing, air passes through the nose and upper airways, which naturally warm and humidify it before it reaches the lungs. But when we use endotracheal tubes or laryngeal masks during anesthesia, we bypass this natural pathway. Challenge 2: very dry medical gases. Anesthetic gases and medical oxygen are intentionally dried out to protect the equipment from water vapor buildup, which could cause damage or even bacterial growth. But these very dry gases add to the loss of humidity. Challenge 3: mechanical ventilation. It is another factor that complicates humidity levels. Unlike natural breathing, ventilators don't add any moisture to the air, so airways can progressively dry out if we don't take extra humidification steps. So, to recap, here are the three main humidity challenges in anesthesia: bypassing the natural humidification of the upper airways, using dry medical gases, and the dehydrating effects of mechanical ventilation. Next, we're diving into why keeping airways moist in the OR is so crucial for patient care. First up, let's talk about mucociliary dysfunction. The cilia, tiny hair-like structures in our respiratory tract, need moisture to move mucus along smoothly, trapping dust and germs. But when we're breathing dry gases during anesthesia, this natural process slows down, mucus builds up, and there's a higher chance of airway blockages. Next, we have the protective lining of the airways, or the respiratory epithelium. When it's exposed to dry gases for too long, it can get irritated and inflamed. Imagine your skin on a cold, dry day. It gets chapped and sore. The same thing can happen to your airways, increasing the chance of infection and complications. Inadequate humidity can lead to heat loss, especially in babies and young children, who are more prone to getting cold during surgery. Proper moisture levels help keep them warm and stable. When humidity levels are high, it can lead to serious complications for patients. High humidity promotes bacteria and fungal growth in breathing circuits, increasing infection risks. Too much humidity traps heat, risking hyperthermia, especially in patients who can't regulate temperature. Condensation from high humidity can interfere with ventilators and other equipment, affecting performance. Excess humidity can increase mucus production, complicating airway management. Let's dive into some key techniques for managing humidity during anesthesia care. First up, low-flow anesthesia. By reducing fresh gas flow to about 0.5 to 1 liter per minute, we're able to conserve both heat and moisture within the breathing circuit. This keeps the airways more humidified and leads to better patient outcomes with fewer post-surgery complications. Next, let's talk about heat and moisture exchangers, or HMEs. These are small but powerful devices placed between the endotracheal tube and circuit. They work by capturing moisture from the patient's exhaled air and releasing it back during inhalation, helping to maintain stable humidity levels and reducing the risk of airway complications. For longer surgeries, active humidification systems can really make a difference. These systems go beyond passive options by actively adding heat and moisture to inspired gases. They're particularly beneficial for high-risk patients, like pediatric and elderly populations, who are more susceptible to the effects of dry air. And finally, modern anesthesia machines are making big strides in humidity control. Machines like the Draeger Primus include built-in humidification features, using hot plate designs that help keep moisture and temperature levels steady. These advancements minimize drying effects and enhance patient comfort. Each of these techniques plays a critical role in protecting patient airways during anesthesia, helping us maintain just the right balance of humidity. So that's why we take humidity seriously in anesthesia. It's a small detail with a big impact on airway health, lung protection, and temperature control. Thanks for tuning in to Optimal Anesthesia Insights. Don't forget to subscribe to keep learning how we're making anesthesia safer. See you next time.